to the Chiro Business Mojo Podcast, where we deconstruct the methods, marketing, and mindset of successful business people and chiropractors from around the world. And now your host, Dr. Richard Day.
Well, hello there. I am Dr. Richard Day, and this is the Chiro Business Mojo Podcast. Hey there, how are you? Thanks so much for checking in with me again today. I am thrilled to be here. And you know, being a chiropractor is a unique form of healthcare, and it's different than our allopathic health partners, the medical doctors. And some of us get along great with them, and others don't. I happen to be a chiropractor who has no problem partnering with healthcare providers such as medical doctors because I really want our patients to have every tool at their disposal to take the best care of their health. And today on the show, joining us is Dr. Abid Bhat. He's an MD and has an MBA as well. He completed his fellowship in sleep medicine from the State University of New York at Buffalo, and he earned his master's in business administration from the Bloch School of Management in 2014. He's been a sleep medicine specialist for over 10 years and is a firm believer in integrating Western medicine with Mind-Body Therapies. He's currently a professor of medicine at the University of Missouri, Kansas City School of Medicine. His passion is to present sleep as the essential ingredient to maintain a positive state of health and well-being by combining Western medicine and holistic medicine. He's given lectures on sleep medicine at the local and national levels, and his research has been published in a number of reputed national and international journals. And he's been regularly featured on local news channels. And recently, he's partnered with Dr. Michelle Robin, who, that name might sound familiar to you. She has been a guest on this program. She is a fantastic chiropractor. She has been practicing here in the Kansas City area for 20 years plus. But Dr. Bhat has worked with Dr. Robin, and the two of them together are partnering to help their patients really discover the key to their health. Let's welcome Dr. Abid Bhat.
Thank you very much, Dr. Dave.
Well, thank you so much for taking some time to join us today, and I invite you to jump in and fill in any gaps in the bio that I may have missed.
I think you got it. Thank you very much.
Well, it sounds good. You know, we talk to a lot of different chiropractors on this show and business experts, but you are the first medical doctor we have had on the show, and we really appreciate your time today.
It's my pleasure to be on your show.
Well, let's talk a little bit about what you do. You are involved in sleep medicine, so why don't you go ahead and tell us about that and the work you are doing in sleep medicine?
Yes, I have been in the medicine field for the last 10 years, but my major passion is sleep. And the reason is it can change our lives. I've been doing it for the last 10 years. I've seen people with lots of sleep issues, and they're connected with your health, with your daily activities, with your sleep symptoms. It can impact your family. So it's a huge problem in our country. And I think this is something that has been ignored for a long time, but that should be talked about because it's going to impact our health in the long run.
Yeah, I think it's so important and often ignored. You know, it's the rest and restorative phase of our bodies, and I think the American lifestyle does not lend itself to getting enough sleep. So, are we getting enough sleep? I think I know the answer to this, but how much sleep should we be getting if we're not getting the right amount?
It's a very important question. The answer to whether we're getting enough sleep is no. So, 1 in 4 adult American doesn't get enough sleep. In fact, we're in a stage of what we call sleep epidemic, where people tend not to sleep enough. And it depends at what your age is as far as the need for the sleep is. Like, if you take an example of a newborn, they sleep for 16 hours. But as you get older, the toddler, they may need 10 hours. And as you go into high school, you may need around 8 to 9. And as you get older, on an average, the guidelines say maybe 7 to 9, but again, depends on how much sleep do you need as an individual. For myself, I know I need 7 hours. If I sleep 6 hours, I am sleepy the next day. But 7 hours is something that I picked up is enough sleep time for me.
So if someone comes to your clinic and you study sleep exclusively, is that correct?
Yes.
So if I were to come there and saying, you know, I'm not feeling well, or I'm not healing well, or I'm just always experiencing fatigue, which, by the way, in my practice, I hear a lot of people talking about fatigue. They may not say sleepiness, but low energy. And, you know, we're at a point now, as I'm sure you know, Red Bull, all of these energy drinks, we seem to be literally just dying to get some sleep. So if someone approaches you and has a problem of fatigue or something like that, how do you treat them?
Well, fatigue could be from a number of reasons, and sleep can be also one of the reasons. So how I approach it is I have a very detailed history that I ask the person and the spouse. One thing that I really love to have in my field of sleep medicine is to have the bed partner with me. Many times the person will deny unintentionally. I'm not going to say it's going to be deliberate, but they say, well, my sleep is fine. I don't do anything strange in my sleep. But then the bed partner goes, no, this is what you do. You gasp, you choke, you bother me, I'm nervous about you, you kick, you thrash around, you wake up middle of the night screaming and yelling, and the person goes, is that me? So many times the person doesn't know what's going on with his sleep. So that's one thing. The other thing is many times we underestimate our sleepiness. We say, I'm fine, or this is me. If I'm tired, if I'm exhausted, it's me, it's not going to change. Many times, it's not you. Things can be more different. Things can be more better for you.
So it begins with a conversation, and do you end up? Is there a therapy you perform, or do you end up prescribing something? What is the treatment for the sleep problem?
Well, there are a number of treatment options depending on what our diagnosis is. For example, there's another epidemic of sleep disorder with insomnia, where people literally can't fall asleep or stay asleep. I have seen so many people coming to my clinic literally crying. They're in tears that they can go to sleep. So then we had to find out what is the reason for the insomnia. Is it the anxiety disorder? Is it depression? Is it the stress at work? Is it the stress of handling the family? Is it the stress of, or it could be from a number of medical reasons. For example, I'm sure you see a lot of people with pain syndromes. So I have a patient with back pain or hip pain or knee pain. They can't sleep. So my answer is, gosh, let's fix our sleep, like the pain issues. Can we send you a chiropractor? Can we realign your spine and see if it can make you feel better, and then you can have more restful sleep? Or there are a number of medical disorders like heart failure. So insomnia or disturbed sleep is very common among people with heart failure or lung disease or smokers who have COPD or patients like stroke. The common medical disorders have high prevalence of sleep issues. So again, the treatment will depend on what the diagnosis is. Now, another common disorder is sleep apnea. Almost 20 million Americans have sleep apnea. Again, unfortunately, 80% of them are still undiagnosed. And it can have significant implications. For example, untreated sleep apnea has been linked to a number of serious disorders like heart failure, heart attack, stroke, diabetes, obesity, depression, anxiety, panic attacks. So here you go. If you have sleep apnea, we need to treat it. We need to let the person know why we can't let it go like this.
Well, I'll tell you something that I see in my practice quite often is fibromyalgia. And I read some studies, it's been a few years back, that those were, they were not sure if it's a causal link, but there was a link between sleep disturbances and fibromyalgia symptoms. And beyond that, they saw a link between depression and how that affected sleep. And it turns out that there was at least correlation between all three of those, the fibromyalgia symptoms and the sleep disturbances and the depression. So I guess I have a couple of questions around that, since that's something that's musculoskeletal that we see as chiropractors a lot. Is the research still pointing to that?
Yes.
And are you, is, I guess, reaching out to maybe psychologists and therapists also inclusive in what it is you recommend?
Absolutely, yes. In fact, I had a patient yesterday. This was like a 46-year-old female diagnosed with fibromyalgia, having very poor sleep. She can't fall asleep because she's in pain all over. And she was literally forced by her spouse because she would be up all night in pain. And she was the one who was in tears because she can't fall asleep. So when we did talk to her in more details, it was a fibromyalgia that was one of the main reasons for her insomnia. So we talked about, in fact, she looked very depressed to me, and there you go. So my plan was, okay, I'm a sleep doctor, I can help you with your insomnia symptoms, but we need to get other experts involved, like a psychologist and a person who can address your pain. So again, it boils down to teamwork. Now, I'm going to help you, but I cannot fix other problems. We need help from other experts too.
Well, and I guess that leads me into my next part of the interview, and those are questions around how chiropractors and medical doctors can help each other. I think that there are all different kinds of chiropractors, just like there are all different kinds of specialists in terms of medical doctors, and we don't always understand each other, but we certainly, in many cases, we are co-managing. A patient may come in, and they might have you as a primary care physician, and they might have me as their chiropractor, and I am always looking for ways to partner with the medical community because we are caring for the same folks. And the way you and I met, so that I can tell the story, is through another chiropractor, Dr. Michelle Robin, who's been on the show. And you guys are working together. So why don't you tell us a little bit about how that came about and how you are working together with other forms of healthcare?
That's an amazing story, Dr. Dave. So meeting Dr. Michelle Robin, who's a chiropractor, wonderful person. We love her being in Kansas City. She's one of the best things that we can offer from Kansas City. So when I met her, this is something I was looking for. I'm in dealing with patients with sleep issues for the last 10 years, but I'm missing something. I'm not able to fix all their problems. What else can I offer? And then I was working on this plan that can something else be done? And when I met Dr. Robin, something happened, honestly speaking, that I said, gosh, this is the person I need to talk to, because the way she approached me and she said, well, we need to talk about it. So we had a couple of meetings, there it started. So we have a common clinic in the same building where we provide all the care, like the Western medicine, alternative medicine, including chiropractor, nutrition, exercise, acupuncture, all those things right under one roof in the same building. So the patient doesn't have to drive all the way from point A to point C. He or she can get all the treatment options right under one building. And we talk to each other. And guess what that has led to? Patients are feeling better. And they're happier. And I'm happier too, because I feel that my patients are getting better care. So it's great, really great.
Well, what kind of cases are you guys managing together or co-managing?
One common example is pain syndromes. I've seen so many people with insomnia who can have chronic back pain or stiff bodies. And this is one thing that we interact. And then we cross-refer patients in the sense, like I get patients from other experts who now, because we do all discussions, we do presentations, we do seminars, we do lots of events, and we talk about what we offer to our clients or patients. And says, oh, okay, I didn't know that. This is my patient, he may need your help. Or I say, oh, this is my patient, he may need your help. So we're basically talking to each other, which unfortunately had not happened for a long time.
Well, what can chiropractors do to really identify? We always ask about, how much water do you drink and how much sleep do you get? Should we sort of automatically think of someone such as yourself in those instances if the person is having some pain, or do we, treat them conservatively using our methods, the adjustment, and then refer you? How should we identify the things that you can help with?
Well, it's important to know that sleep, along with diet and exercise, is one of the pillars of health and wellness. There's no question about it. Now, it's very common to have sleep issues. Almost all of us have sleep issues. Who doesn't sleep? There's no one in the world who doesn't sleep. Like, it's not that I have diabetes or I don't have diabetes. So all of us do sleep, and most of us have some sleep issues. If they're transient, it's okay. But if you have a patient or a client who has some sleep issues, then maybe we need to dig in more. Like, we never ask a patient, I'm talking about primary care physicians in our field. They don't have time, I believe, or they don't think it's important for a person to ask, how did you sleep last night? How do you feel? How's your sleep? How's your spouse talking about your sleep? So what I do is, and I ask for in my seminars or my events, spend maybe 30 seconds or maybe 1 minute asking the person about your sleep symptoms or sleep habits. How are they feeling during the daytime? Do they struggle to stay awake during the daytime? Do they find it hard to go to sleep? Because once you start asking them, honestly, you get a barrage of questions or points from the patient says, yes, 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 and yes. And there you go. Then you can start managing the patient yourself. Is there something like a pain syndrome or something malalignment in their body or their body structure, the spine, that can be fixed? And if it's persistent, is it the time for me to send this patient to a sleep doctor for further evaluation? Because it's not uncommon. As I said before, there's an epidemic of sleep disorders in this country, which unfortunately has been ignored, and it is taking a toll.
Yeah, I have to agree. I mean, I just think that that's the society we live in. We go, 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 and not. I know myself. I include myself in this. I don't get nearly enough sleep. I've got kids and own a couple of practices, and I mean, there's a lot going on. So I think you're absolutely right. And as doctors of chiropractic, we're always looking for an underlying cause that is causing the symptoms. And you're right. I don't think sleep is getting enough recognition as a culprit these days. And so I'm so glad that you're doing the work you're doing and helping people open their eyes to what might be going on to cause these problems. Well, I want to shift a little bit, and that leads me to my next topic, is really the different paradigms that medical doctors have as compared to doctors of chiropractic. And I think over the years, just my own personal observation, and I've been in practice less than 10 years, but I see more and more doctors who are medical doctors kind of approaching things holistically, whereas maybe before that wasn't, they were just looking at their specific system and their specialty. Do you agree with that? Are medical doctors starting to take a little bit more holistic approach?
I think they are, but I'm afraid we're not doing enough. I think a lot more needs to be done, because what I believe, my own perception, is that our goal should be my goal as a sleep doctor is to reverse sleep disorders by looking at the cause rather than simply treating the symptoms. I'm sure you know about the medications that people are taking for sleep. Like, I'm not going to name any specific medication, but they are like, it's an addiction, I can call. Honestly, there are some patients who do need some medicine, but I don't think we should make it a blanket treatment. We need to find out why they can't sleep, rather than giving them medication to force them to go to sleep. Many times, talking to the patient, finding out the reason is enough. I strongly believe in psychotherapy. I strongly believe in alternative medicine like acupuncture. I strongly believe in relaxation techniques. Those are the things that most of us need to, because the stress in our lives, our lives are packed with things to do, as you said. People have forgotten to breathe. Take a deep breath. I think that's one of the treatment that we need to do, is take a break, 5-10 minutes, spend your time for yourself. I think that's one of the treatment too for people with sleep issues.
One of the things I always ask people, and I'll be asking you this later, is what do you do on a daily basis to help you, keep on track with your goals and your success in your life? And meditation is a very common answer. So I think I'm starting to see that that's being incorporated a little bit more and more into Western lifestyle. Where we're small, but it seems to be growing.
Yes, I totally agree. In fact, I go to different places, and I'm very happy and delighted to see more and more people are getting into these treatment options like meditations, yoga, and other alternative options. In fact, if I'm not wrong, one of the major insurance companies is paying its employees $500, I believe, to do all those things like getting enough sleep hours. So they're tracking their sleep hours. And if you do sleep enough, you get an incentive. And I'm really delighted about it.
Yeah, that's great. If we can incentivize wellness, I mean, we're shifting it from the let's not treat it until there's a symptom or complaint to let's just perpetuate wellness so that there maybe will never be a symptom. And
yes.
And as long as the corporations are footing, a major part of the bill for our health insurance in this country, I can see how it's in their financial best interest and also in the health by the best interest of their employees to subsidize that as well. Well, let's talk a little bit about what chiropractors can do to approach the medical profession. If I didn't know you or like Dr. Robin didn't know you and she reached out to you and you guys had a conversation, how can we as chiropractors, make better connections with you in the medical community?
I think it should be a two-way traffic. It's not only chiropractor doctors who should come into, medical doctors. I think we should come in too, because our common goal, I believe, is provide a better care for our patients. And I think talking to each other, opening up ideas to each other, that's what we're trying to do. That's why I'm fascinated working with Dr. Robin is she has allowed me to contact her co-workers and other people are spreading. In fact, I'm going to be seeing her later this afternoon at an event. I'm sure we're going to see more people. I think we need to talk to each other. That's what it is. I have approached a number of alternative medicine experts in the town. Hey, I need to talk about what I offer and I need to know what you offer. Spending 5-10 minutes is not going to take away much from me. And in fact, I learn different things from them.
Yeah, it's so important. I'll tell you a story. One time when I was early on in practice, an orthopedic surgeon reached out to me and wanted to meet with me. And I was shocked. First of all, I hadn't been out of school all that long, but, second of all, I just was not thinking that medical doctors would really want to work too much with us or find out what it is that we do. And so I went to the meeting, and it was really fantastic. His approach was, look, not everyone is ready to be on my table getting an operation. And right. He said, maybe you can tell me what it is you do, and maybe I can send some patients to you if they're not quite ready to undergo a surgical procedure. And by the same token, I had people in my practice that I was not able to help. We gave it our best try. We did maybe, a couple of care plans, completed a couple of care plans, and we just didn't get the result we were looking for. And unfortunately, these people did need to go get something a little more drastic, which included surgery. But, that one meeting I had was really good to help each other, but it was so good to help so many patients. We've co-managed for years since then. And I think there's just really great power in being able to serve our mutual patients in partnering, and would love to see more of it. Is there anything that maybe medical doctors should do to maybe, spark their curiosity about chiropractors, or maybe to help them get past things that they may have heard? Anything you can think of that could help from your direction coming to our direction?
I believe, in the medical school, when I was in medical school way back, many, many years ago, nobody talked about alternative medicine. But what I have noted in the medical schools right now, that the medical students are being talked about different treatment options. So I think things are changing. I think we're getting cognizant of we're lacking something. Western medicine is good, but I don't think it's complete. So people are looking for other options as far as it could be primary care, as you mentioned about orthopedic surgeon, about patients with heart disease, patients with chronic back pains, patients with multiple sclerosis. If you look at, the football season is at the peak. You have lots of people who work with football. Like, they have all these injuries. Most of them don't need surgeries. Can they go and see a chiropractor who can help them fix all these issues? So again, it's like more awareness, more talking about things like chiropractor treatment options that can be beneficial for our patients. It's all, I think, education of physicians who have Western medicine philosophy that need to be made more aware about chiropractor medicine.
Well, let's take a step back now from the specifics we've talked about in terms of sleep and partnering with medical doctors and doctors of chiropractic. Let's talk about the bigger picture of just being successful in life. And you've obviously had a lot of success in your life, and we learn a lot from being successful, but we tend to learn even more from obstacles that we have overcome. So can you think about it and share with us something in your life that you have overcome? It could be a failure, an obstacle, a challenge, and the lessons you learned.
I'll go back to my practice of sleep medicine until I met great people like Dr. Robin. I was 100% into Western medicine. Honestly, I don't feel bad that I didn't have any knowledge about alternative medicine until recently. So I didn't believe, or I didn't have knowledge about it. That was a problem. And that was one of the reasons, or maybe you can call it a failure, for many of my patients to come back to see me after a year. The same issues going on. They would still struggle with all their sleep issues, especially with insomnia. I would order a sleeping aid or any antidepressant medication for them. They would come back and say they feel more zombie, they feel more tired, their symptoms are still persisting. So that was one of my limitations until recently, that I wouldn't go out of my knowledge base. And it has been a wonderful experience breaking down that barrier and looking around saying, it's not only me. There are many more expert people around in the community who can offer some better treatment options to my patients. And I think that has been a really great experience for me.
Yeah, I think that is key in a couple of ways. There's a saying that we've heard on this show from a couple of guests that are basically all the great things happen in life outside of our comfort zone. And so, if we stay within it, we're kind of confined by it, whether or not we realize it or not. So kind of breaking through that barrier is such a great idea. So I thank you for sharing that with us. I want to ask you this. Who are your personal heroes? My
parents, I believe, especially my mom. They have been very helpful to me. My origin is from Kashmir, India, and it was because of my parents I have been successful, and I'm blessed. They always pray for my good health, for my success, and I cannot admire them more than they have done to me. Like, they are my personal heroes all the time.
Well, do you have any daily habits, rituals, affirmations, anything you do every day that helps you keep your eye on the ball?
Yes, I do meditate. And again, I've been more punctual, more regular only after I got involved with my peers. I'm talking about Dr. Robin and other people in my next phase of life, what I'm going through right now. That's one thing. Another thing is I do listen to Bollywood music. That makes me feel good.
It's the little things, right?
Yes, little things, but they do count.
Well, our time together today is sadly coming to a close, but before we let you go, I do have a few final thoughts. Yes. Is there a favorite book you would like to recommend for our listeners?
There are a number of books published by Dr. Michelle Robin. I would want your audience to read about it. Just Google Dr. Michelle Robin. Her name will be at the top. And read about how she talks about different quadrants of life. It's not only mechanical, it's chemical and other things. It's all a combination of things that we can assimilate and come up as a better person and as a better society. So I would strongly recommend reading her books. A lot of good, nice books.
Well, we will link to those in our show notes page for those who want to check it out and maybe pick up a copy for themselves. What is the best business advice you've ever received? Listen.
I think that's one thing I really learned, that if you listen to your patients, they're my clients, but they're my patients, they want someone who listens to them. Unfortunately, in our medical business, we rush through our treatment plans. We don't listen to the patient, we just prescribe medications. But spending extra 5 minutes and letting the patient vent out his feelings is itself a treatment, I believe.
Yeah, I got to tell you a quick story. So a friend of mine, a personal friend of mine, is also my dermatologist, and I went and saw him recently at a hospital where he works, and the lobby was crowded, and I got pretty close. I only waited about 20 minutes for my appointment. I wasn't too late, but I got in the room. It took me a little while before he was able to come in, and when he came in, it was just very, very quick, and he was out the door, and I didn't blame him because the demand, there were, a waiting room full of patients that needed to be seen, and there just isn't time, at least for him, to be able to listen and make those connections, and I haven't had a chance to talk to him since I was in there, but, he does very well financially, but I don't know how fulfilled he is in being able to provide patient care.
I agree. Is there a feeling of satisfaction? I'm not sure.
Well, what is the best way for people to contact you and find out more about sleep medicine?
They can Google sweetsleepstudio.com. Again, I'll repeat it, sweetsleepstudio.com. Or they can Google my name, Abid Bhat, MD, sleep doctor. I'm here in Kansas City. And if there's anyone who wants to contact me, I'll be delighted. I'll be happy to talk to them on the phone and all those things. I'm here. I'm here to listen.
Well, Dr. Abid Bhat, thank you so much for your time today and sharing your side of what's going on with healthcare and specifically how we can partner together to help with a variety of complaints that we see as chiropractors and that you see as a medical doctor. Thank you so much for your time.
Thank you for inviting me to your show, Dr. Day. You have a wonderful day.
Thanks for listening to the Chiro Business Mojo podcast at www.chirobusinessmojo.com.